This is your Spotlight on Now. I'm Kimberly D'Souza. Now, Vaccination Week in the Americas is an annual public health campaign by PAHO member states to promote equity and access to immunization. And here to talk about what we are doing locally is Ms. Grace Sookchand, Nurse Grace Sookchand, who is the manager of Extended Program for Immunization at the Ministry of Health. Grace Sookchand, good morning, nurse, and thank you so much for joining us.
Good morning, and thank you all for having me this morning.
Now, Nurse Sookchand, when was Vaccination Week in the Americas first started, and why is it such an important event?
So it first started in 2002, and it was actually prompted by a measles outbreak in Colombia and Venezuela. And the then ASEAN ministers of, or the ministries of the Americas decided that we should celebrate Vaccination Week of the Americas because it's an opportunity for us to reach those who are unvaccinated.
Nice.
And then in 2003, the Directing Council of the Pan American Health Organization adopted it as an annual initiative.
And when did we first start celebrating it or commemorating it here locally?
So we actually started with the Americas. The vaccination program was introduced in Trinidad and Tobago in 1974. And since then, being part of the region of the Americas, we also started in 2003.
Now, does this coincide with World Immunization Week?
Yes, it's actually the 11th World Immunization Week as well.
Nice. Now, I saw that the event was launched on Saturday. What sort of activities were held on Saturday?
So yes, we had a successful launch on Saturday, and we actually, apart from just giving vaccines, we teamed up with other sectors of the Ministry of Health, NADAP, the mental health, the units. We also partnered with Metabolism Division, the Directorate of Women's Health, and we also had a collaboration with the Cancer Society of Trinidad and Tobago.
Nice. And what was the turnout like on Saturday? And where was it, in the east or the north?
So we actually launched at Trin City Mall. We've done that there before very successfully. We had a lot of shoppers, a lot of persons who came in. We had a huge crowd actually, but we managed it. All public health guidelines were strictly followed, but it was a successful launch. And persons were able to not only get vaccines, but have their routine screening done. They were able to interact with the other departments and get information on what is available on health, a holistic approach.
And what are some of the activities we can look forward to during this week?
So during this week, all health facilities will be offering vaccines free, without a clinic appointment. Persons can just walk into any of the health centers and have their vaccines updated. If they have any questions or any concerns, we also are asking parents at this point in time to walk with their children immunization card if they're not sure about what vaccines their children are supposed to receive. Apart from that, we want to also emphasize that vaccination is not only for children, it is now throughout your lifespan. So adults may require certain vaccines that they have not had or need to update. For instance, like every 10 years, you're supposed to have a tetanus vaccines updated, and then our pneumococcal vaccines every 5 years.
Because I was just about to ask, I know there are some people who may not be able to locate their vaccination cards at this point, but they're hearing that Vaccination Week in the Americas is going on, and they're probably saying, I may need to get a booster. How will that work?
So again, you walk into the health facility. If it's a health facility that you belong to, they may have copies of your records. And if you misplace your card, they can replace it. Apart from that, if you cannot find the card and you went to a facility maybe years ago and you just can't remember, most of us don't really visit a facility frequently, and then you can't remember. That's okay. Adults are supposed to have certain vaccines, and we can actually give you vaccines and give you another card.
Now, what about Tobago? Do we have this targeted for the Tobago residents as well?
Absolutely. All 109 health facilities throughout Trinidad and Tobago will be offering vaccines. And let me say, some of the other areas will also be, highlighting other initiatives. They would also have, for instance, they may have dietitians who may be there. They may have persons doing displays, everything related to health.
Now, Nurse Sookchand, you said that we have been commemorating this day, since in the 70s. I mean, what sort of achievements have we seen thus far?
So, in terms of commemoration, being a member state of the Pan American Health Organization, we were the first in the region to eliminate smallpox in 1971. That was a huge achievement for the Americas. In 1994, we eradicated polio. Again, proudly, we are a member state. In 2015, congenital rubella syndrome was eliminated, and in 2016, we were certified measles-free. And these are accomplishments that we are extremely proud of, and we really want to continue with that achievement. And currently, the Americas are looking to eliminate diphtheria, pertussis, neonatal tetanus, or childhood tetanus. And, we are also working alongside with them, and thankfully, we have not had any cases.
Now, Nurse Sookchand, what are some of the diseases that we should be, vaccinated against? So how many are there, and how many vaccines are there?
So we have a range of vaccines that start from childhood. Our vaccination program actually starts from 2 months of age for babies. And in that area, we give polio. We start off with what we call pentavalent, which is 5 vaccines in 1 shot. So it is diphtheria, pertussis, tetanus, hepatitis B, and Hib influenza. We also have the pneumococcal vaccines for children, the Prevnar 13. We have later on, after receiving their 3 doses of hepatitis B and Hib influenza, we continue with the diphtheria, pertussis, and tetanus, 5 years of age. We include at 1 year of age, your first MMR and polio, yellow fever, and then at 2 years of age, we give the second MMR vaccines. We also give booster doses of your Prevnar or pneumococcal if children needs it. And then when a child reaches primary school, just before they go on to secondary, around the time that they're writing SCA or preparing for SCA, we give them the tetanus vaccine, and then we start the HPV vaccine, which is 3 doses of vaccines that we give. So throughout that, after that, persons are required to get booster doses of tetanus. And again, we have like meningococcal vaccines. If it is required, a doctor prescribe it, we give it. We have the chickenpox or varicella vaccines. So as you can see, we have quite a range of vaccines that is available for persons from childhood into adulthood.
Now, Nurse Sookchand, I know a lot of people, their focus would have been on getting the COVID-19 vaccine. Correct. Because, of course, that is the most threatening thing you could say right now.
Correct.
Because of the COVID-19 vaccine, has there been a decrease in the other types of vaccines?
I'm glad you brought that point up and highlighted that point. We have noticed, and I guess it's because of the shutdown, the lockdown that we had, measures put in place, and of course general fear of the population in contracting COVID-19. We saw a sort of reduction in the amount of parents keeping their children appointment for vaccines, specifically as it relates to MMR vaccines. Now remember, these are vaccines that you need for school. And because schools were closed, you find that parents felt that maybe it wasn't important to get the vaccines because your children was at home. But we have to remind the population that these diseases don't really respect lockdown or anything like that. So we need to ensure that our children are vaccinated and, receive all the vaccines that they can, because these are diseases that can be prevented, unlike other diseases, by vaccines. COVID-19 is another vaccine that we've been encouraging the population to come out and get. We have vaccines available. Now, one of the primary initiatives of Vaccination Week of the Americas is the availability of vaccines and accessibility of vaccines. The Ministry of Health has ensured that there are vaccines available, and we have tried our utmost to make sure that the vaccines are accessible. We've gone into communities, we've visited areas like Home for the Aged, we've had school initiative, we've had initiative at workplaces, we have mass vaccination sites set up throughout the length and breadth of the country to make vaccines accessible for everyone. And yes, unfortunately, we still have persons who are on the fence and wondering, should I have my vaccines? Another vaccine we've been promoting is the annual influenza vaccines. And unfortunately, our response has been poor. And it's because the population tends to be reactive. Only when you have high number of cases or unfortunately someone dying, we see people coming forward and then lining up in long lines when these vaccines are available. And the Ministry of Health has been, through the press conference, through all different media, have been letting persons know we have certain vaccines that is available, and this is where you can get the vaccines.
Now, Nurse, I know that there has been conversation from, of course, the Minister of Health, who's saying that we have been moving along in terms of getting the vaccines for that 5 to 11 age group.
Correct.
But there are still parents who are concerned about it. I mean, now all the levels are back out of school, but there are still parents who are concerned about it. What can we tell some of those who may be watching right now?
Again, as the Minister of Health likes to say, we should trust the science. Vaccine has been proven to work. It's because of vaccines, smallpox that killed millions of people was eliminated. We have seen the success of vaccines like measles, polio in Trinidad and Tobago. Currently, there are some countries where there are outbreaks, but because of our robust vaccination program, and not only that, not all countries offer vaccines free of charge. Trinidad and Tobago offer vaccines free of charge to the population. So I would advise parents, I know you're concerned, all of us as parents should be concerned, but we need to read, do our research, look at the success stories. Yes, unfortunately, for all vaccines, you may have some persons who may have an adverse reaction, but then it's like 1 in 100,000 or so. It's not that common, but we need to really focus on the safety, on protecting the lives and the health of our children.
Now, I know there has also been some conversation in terms of if these vaccines are, effective enough against the virus. I mean, the vaccines that we are getting. I mean, what is the efficacy like?
So,
as relating to COVID, of course.
The vaccines we are getting has been tested, and before it reached Trinidad and Tobago, it has been given out internationally. So we had we had time to actually assess the efficacy of the vaccines, and obviously, before a vaccine is approved by the World Health Organization, it goes through a lot of rigorous testing. A lot of data is collected. We monitor persons to see what reaction that they are having, how effective we say that the vaccines are. Now, there are some persons in the population, even if you give them a vaccine based on their immune history or the genetic makeup, they may not have that level of protection. But usually the general population would have that level of protection against these vaccines. And the World Health Organization would not approve something that doesn't have a high level of efficacy. When introducing vaccines, what they look at is the risk bed analysis, zero risk analysis. Is it better to give the vaccine, or should we let the disease progress? As we have seen with COVID-19, millions of people have died with COVID-19, and we've seen since we've given the vaccines throughout in countries there have been a reduction. It will not totally eliminate the possibility of you getting the virus, but it gives you a better chance if you get the virus even after you're vaccinated, of your body's ability to fight it off. We have seen persons' testimony who have gotten COVID, long COVID, and even last week, Friday, I've had the opportunity of listening to a gentleman spoke about his experience with long COVID, and he told us it happened in 2020, and he still feels the effect of it, and that is really sad. And if the vaccines was available at that time, he may not have had this effect now. So really and truly, we need to trust in this. Yes, we can eat healthy, we can take our rest, we can try our best to protect ourselves and our families, and we should do it. But if there is something out there, a vaccine that we have seen over the years have worked and proven to save lives, we need to trust the science. But we need also to ask questions. Don't just take it that, okay, there's a vaccine available. We expect you as parents, we expect you as responsible individuals to do your research and ask questions if you have concerns.
And Nurse Sookchand, finally, anybody who's watching and just wants to get more information about Vaccination Week in the Americans, can you give us a number or a website we can go to?
Yes. All information are available on the Ministry of Health website, www.gov.health. TT. We also ask person that you can call us at the expanded program on immunization at the Ministry of Health. Our number is 627-9085. You can also check the Ministry of Health Facebook social media pages and you can get information. We also use the press conference as opportunities to give out information as well to the population. So we ask people to please tune in to those press conference and listen for information that we can give on all vaccines and also all programs that's offered by the Ministry of Health.
Nurse Sookchand, thank you so much for coming in this morning and sharing, what the ministry has planned for Vaccination Week. I hope that we do see that uptick in other vaccines so that we can protect our country. Thank you so much.
Definitely.
And that was Nurse Grace Sookchand, the manager of the extended program on immunization at the Ministry of Health, just sharing what the ministry has planned for Vaccination Week of the Americas, which is taking place this week. We're going to take a break and be right back. Stay with us.